We begin with breaking news as Hamilton County leaders say that we see an exponential increase in the number of cases of COVID-19. That's how public health leaders described this pandemic this morning at the county's weekly briefing. Our Local 12's Alexa Helwig is live now in our breaking news center with updated county numbers and how hospitals will prepare for a surge. Hi, Alexa.
Liz, public health officials say we are at a critical moment and the community needs to start working harder to slow the spread of this virus. Right now, Hamilton County has hit 5 of the 7 indicators that could turn it purple, and that's on the state's color code advisory map. So let's jump into the numbers. This week, there are a total of more than 16,000 cases, and there are around 1,300 new cases compared to last week's number of about 950, and there are 41 more hospitalizations in Hamilton County. But in the region, there are more than 200 people hospitalized, and that's a record number since the pandemic hit. The spread of COVID-19 is said to be coming from more informal settings as people start to move indoors and not wear a mask. The president and CEO of UC Health, Dr. Richard Lofgren, talked about how the hospital system is preparing for a potential surge. He says as we see a higher case numbers, this is not just a matter of testing more. These cases are translating into more hospitalizations. He says hospitals are more prepared for a surge since the virus first hit in March and April.
We've learned a lot during that time period and are prepared. One of the things that's really quite different than what was happening in April and March and April is we actually now do have what appears to be an adequate amount of PPE and other equipment and supplies. We have trackers both at the county level as well as the state level, making sure that these resources are available.
And there are still detailed plans in place if hospitals were to see a major surge. And Dr. Lofgren also says they are prepared for an alternate care site if it's needed, but that is also down the line. And he also added, at this time, there is no need to suspend elective surgeries. In the Breaking News Center, I'm Alexa Helwig.